On this segment, we're here with Dr. Rena Marino, and Doctor, thank you for joining us. Tell us a little about what you do and how people could take advantage of it.
Sure. I'm an integrative medicine physician in Royersford, Pennsylvania. We're about 20 miles outside of Philadelphia. And what we aim to do with integrative medicine is to combine the best of traditional Western medicine with things like nutrition, exercise, stress management, and by combining or integrating those two to get the best outcomes for our patients.
Is this a specialty, or do all doctors offer this?
This is actually its own specialty, and it actually has its own board certification now. So yes, it is.
So are people aware of it generally, that there is such a thing, or how do they determine they need somebody like yourself?
That's a great question. I think more and more people are hearing about this and are seeking this out. And I think one of the reasons why they look for someone like myself is that in our practice, what we're aiming for, what our goal is to treat each person who comes through the door as an individual. They are not simply a set of symptoms or a medical condition. We want to address the whole person and not only address their symptoms, but look at how they're eating, how they're moving, how they're exercising, how they're sleeping, and how they're managing stress. And our goal is really to optimize all of those factors to get them better and get them feeling good.
Right, because obviously if someone is experiencing something, it might be affecting them mentally as well.
Absolutely. And another piece that we bring to it is the spiritual piece. And we meet all our patients where they are, but we feel that it's important to also address the spiritual aspect of the individual because that's so important in the healing process.
Great thing. Can you give us a couple examples of the types of things you treat?
Right. I would say that there are a few areas of focus. One is for women who are perimenopausal or menopausal and trying to deal with a lot of those kinds of symptoms like hot flashes, difficulty sleeping, weight gain, and we work with them again as the whole person, looking at their diet, their exercise. In certain cases, we look at their hormone status, and if appropriate, we use conservative bioidentical hormone replacement to help them with their symptoms. In addition to the other modalities that I mentioned, we also work with patients who are interested in weight loss. If patients have had COVID and are still struggling with some of those symptoms and want to explore what else they can do to really get themselves back to where they were, we help them as well. And also we're really all about wellness and disease prevention. So if a person knows that they have a predisposition for, let's say, diabetes or arthritis, we work with them to try to get their diet and lifestyle where it should be to help them prevent problems in the future.
And you mentioned COVID. The pandemic caused a lot of stress on people. You find people are still struggling with that?
I do. It's amazing how many people come in and anxiety and stress are a big part of what they're still dealing with. So that's something that we definitely address and have a focus on as well.
Now, you are a medical doctor, so is there anything you don't want to treat or don't focus on?
I would say that we're open to most things. There's not a lot that we say we don't treat, but our process is if someone's interested in coming as a patient, we do ask them a lot of questions. We try to give them a lot of information up front so that we know that we're a good fit.
And what are we leaving out? What haven't I asked you regarding what people would be, someone's watching this and they're saying, is that where I want to go? How do I know? Maybe you could address that, but what am I leaving out in asking you anything?
Yes, well, like I said, we do have a focus with peri and menopausal women, but we're not limited to that. We really help anyone who's dealing with things like gastrointestinal issues, difficulty with digestion, abdominal pain, bloating, that kind of a thing. We also work with people who have difficulty with cognition or memory. We have a whole subset of patients and a protocol that we use to help them. Some people may be aware of it. It is a protocol that was developed by Dr. Dale Bredesen, and it's called the RECODE protocol to help patients specifically with early Alzheimer's and early memory loss.
And in a final word, how do people contact you? What should they do? What's their next step?
Right. Well, they can look me up on the internet. I'm Dr. Rena Marino. If they put my name in, they'll come up with my website. I'm also part of True You Wellness. This is a wellness center where I have my office, and so either way, that probably would be the easiest way to find out where we are and how to contact us.